This is the Valley's original morning magazine show, ABC 15's Sonoran Living Live.
You know, a headache can really ruin your day when your head hurts. Sometimes you can't concentrate and all you want to do is just go to bed. But since you can't check out on life when you have a headache, most of us can't, well then we wanted to give you some tips to keep them away. Dr. Michael Staub is here with some great tips. Good morning to you.
Good morning.
You know, a lot of times people have different degrees of headaches, whether it's a migraine or just something that's just kind of dull but still extremely debilitating. So what determines the degree of pain, basically?
Well, I think the degree of pain varies from the different types of headaches. In our office, we see three main different types of headaches. We see migraines, tension headaches, and cluster headaches.
Cluster headaches, what are those?
Cluster headaches are usually one side of the head. The patient will usually feel it behind their eye. It'll be a searing or burning pain, and sometimes they'll even have some nasal discharge on that side.
Wow.
Commonly misdiagnosed with migraines.
Okay.
So it's really important to get the symptomology down and take a good history from the patient. And in order to do that, you need to spend the time, do some testing. We do some orthopedic testing in our office, and sometimes we even do imaging.
It sounds like there's a lot more complex body issues going on besides just the head, if you're taking imaging and so forth.
You're absolutely right. For example, with migraines, most people don't know this, but a lot of them are actually related to a food sensitivity or allergy. And if you're just covering up with medications, that can go on and on and on and never really address the cause. We like to do a food allergy test and actually eliminate the aggravating food, and by eliminating the aggravating food, wow, magically the headaches go away and the patient feels better.
It's not uncommon to have probably more people come in during more stressful times, and if we're being very honest, it's been stressful with the economy, and it's also stressful during, basically November, December, early January, right?
Yeah, it's easy to say, especially.
So would that indicate that this is kind of like situationally creating headaches as well?
Yes, that's absolutely right, especially with tension headaches, and they will be commonly misdiagnosed as a migraine because people will think, wow, this is a really severe headache and it's been going on for many days. Some of them will even get upset stomachs and nausea, which would kind of mimic a migraine, but they can be every bit as bad, and of course they're related to muscle tension, and that muscle tension can come from poor posture, it can come from misaligned vertebrae, it can come from trauma, those kind of things. Car accidents typically kick off. So
we've established there's three types of headaches. Yes, they are caused by your tension. They're actually, what, 7, but those are the three that you mentioned.
They're the big three.
What can we do from a standpoint, before we get to you, to maybe kind of stay off some of the symptoms of the more severe headaches or even the minor headaches? What can we do? What tips do you have for us?
Number 1, try to keep your stress low. Number 2, try to stay well hydrated.
Hydration?
Sure. Dehydration can kind of affect the brain and the function of the brain and the amount of blood the brain gets.
Interesting.
Another thing they can do is exercise to try to keep stress down. If it's a migraine type thing, they want to probably go and get a blood test and see if they have a food allergy, and it'll definitively tell them if they have an allergy or sensitivity. Eliminate that food and they're going to feel a lot better. So those are the big things there.
Those are the big things.
If you have a cluster headache, they're a little different. They found that there's some actually really good natural fixes for them beyond the medications. So if you're looking for a natural fix, they found that oxygen therapy works really well for that. They also found out that acupuncture, which we do in our office, works really well.
So if we're going to take an over-the-counter like a Tylenol or an aspirin or something like that, Excedrin migraine, what is your favorite go-to to give us a little bit of relief?
They're all pretty good, in doses. The concern with that, as it says on the bottle, is you don't want to exceed that for more than 10 days. If you have a headache for more than 10 days, that's usually a sign of a greater problem that you got to get checked.
All right. There's a lot of jokes here about headaches here, but I'm refraining, and I'm sure you've heard them all.
Some of the people here are causing them. I hope not.
Thank you so much for coming in.
Thank you very much.
We appreciate it.
I appreciate it.
And we're going to provide some more information about headaches and the types of them and how you might be able to get some relief, and also hook you up with the doctor as well to maybe take a little bit a greater step to relieving some of the pain that you might be feeling. I hope you have a wonderful weekend, and we'll meet you back here on Monday at 9.